Thank you very much. Christine?
Great. I hope you can all see me. I'm a little height challenged, so I'm going to try to stay to the side a little bit. But Maxine gave us a great example of cultural transformation, and what I'm going to go over now is a framework that you can use in your own organizations to be able to do similar types of transformation of culture and your work environment. So I want all of you to look at the numbers on the screen. By the year 2020, they've estimated that the nursing shortage in the U.S. is going to grow up to 1.2 million nurses. So this is huge. A shortage this big is about 5 times anything we've ever experienced in the U.S. And this is not really an isolated issue because many countries have been reporting very similar concerns. And if you think about it, 2020, that's not very far away. That's about 6.5 years from now. So it's important for every healthcare organization to try to create work environments that's going to keep the current nurses that we have in the workplace and also be able to recruit additional ones in the future. So as Piera said, my name is Christine Pabico. I am the director of the Pathway to Excellence program, and I'm with the American Nurses Credentialing Center. In my presentation today, I'm going to go over with you the concepts of creating a positive practice environment, talk about some of the return on investment, and also share with you evidence that links this to safe patient care and continuous quality improvement. So this is how our nurses are feeling right now. Because of the increasing demands in healthcare and also combined with poor working conditions, our nurses' stress levels are raising, higher and higher to the point that, they're getting burnt out. Many are wanting to leave their current jobs, and some are even wanting to leave the nursing profession entirely. Linda Aiken did a study just recently in 13 different countries that showed very similar results. It was very alarming actually because it showed that in some countries up to 79% of the nurses were unhappy, and when they asked about how many wanted to leave the workplace, it ranged from 14% in the US to as high as 49% in some of the European nations. So this kind of dissatisfaction and burnout, which of course leads to turnover, is a huge concern because it's not only costly to organizations, but also patient safety and patient outcomes are at stake. So looking at many studies, including that of the IOM report, they really recommend that having a stable workforce and also transforming the work environment of nurses are going to be the key drivers to improving safety and also advancing health. So Pathway to Excellence provides the framework to be able to do just that. And more than 100 organizations have used this framework and have successfully transformed their cultures. What you're seeing up there are the 12 practice standards that studies have found to be foundational elements in creating a healthy work environment. I do want to point out that all 12 of them are equally important, but because of the time constraints that we have today, there's only some that I'm going to be highlighting. But I did bring some bookmarks on the brown table right there at the back. Please make sure you get one before you leave the room. So the first thing that organizations need to do is to give nurses a voice. And Maxine kind of talked about that, making sure that the front line have a voice. And some of the ways that you can do that is by having them participate in interdisciplinary committees, having shared governance in place in the organization, and making sure that they have input in administrative and operational decision making. Many studies have shown that when nurses are involved in decision making, that what you end up with is higher quality of patient care. Many organizations have seen higher safety event reporting, same thing that Maxine talked about, and also they've seen nurses, to be happier and have higher satisfaction rates. They've also seen that when nurses are involved, when they feel like they're listened to by their nurse manager, that they have higher safety initiative success rates. When you have shared governance in place in the organization, it makes them feel like they're not only employees, but they're true partners of the organizations, so then they start owning their practice. And this is a perfect example of that. The Institute of Rehab and Research is one of the Pathway designated organizations. And as you can see, back in 2007, they did have an issue with their ventilator-associated infections. And in 2008 is when they began their pathway journey. And what they started doing differently is getting feedback from their nurses. And what they quickly identified was that the current bundles that they were using, they had to do some modifications to make it apply for their special types of patient population. And they said that simple thing of just, having their nurses participate in this process, the nurses ended up not just accepting the modified bundles, but they ended up really embracing the process. And look at the tremendous results that they have seen. They have completely eliminated their ventilator-associated infections. And it is one thing to be able to improve something, but to be able to maintain it 6 years in a row, truly is an accomplishment in itself. And then the next thing is professional development. It's important that when staff are hired into the organization, that they get a solid onboarding, that they get, individualized orientation, because when they're familiar with their work environment, when they're familiar with policies and procedure, that gives them the confidence and the competence to really take care of their patients. But it's important not to stop there. Organizations need to provide continuous professional development opportunities, because that's what's going to develop their expertise. And some of the examples I listed up there are some ways that you can do that. You can provide continuing education. You can have them be members of specialty organizations, because that's how they can keep current about their specialties. You can send them to outside conferences such as this one, because we all attend this not only for the networking, but because we want to learn about best practices. And then the last thing is promoting certification. And certification is essential because it does validate the nurse's knowledge about a defined clinical area of expertise. So once they become certified, it not only gives them that personal satisfaction, but they also gain a higher level of respect from their colleagues, physicians, and their patients. So this is, again, is a graph that was provided to us by the Institute of Rehab and Research. And they said that when they began their pathway journey, they only had about 4% of their nurses certified. This was something that they really focused on. They had a campaign called Credentials Count, and they were very proud to share with us that by 2012, about half of their workforce was certified. And what they saw was, as the number of nurses, certified nurses, went up, they said they also saw a dramatic improvement in their outcomes. They said that, when the nurses started getting recognized for their achievements, they're the ones who started pushing other nurses to do it. They really started, owning their own practice, and they started raising the bar for patient care. So you're probably wondering by now, why is this all about the nurse? Because what about the physicians? What about the pharmacists, physical therapists? Well, this is not all about the nurse. One of the practice standards really looks at collaboration and teamwork. It's important to encourage that type of atmosphere of collaboration and mutual respect, because nurses don't work by themselves. They rely on so many other disciplines to be able to provide optimal care to their patients. And, I'm sure you all have seen that acronym, TEAM, because together everyone does achieve more. And I do want to point out that, nurses make up the highest percentage of the healthcare workforce. So by, having this kind of initiatives to improve the work environment of nurses, everyone does benefit from it. And the next two slides I'm going to show you just demonstrate, how success can look like when you have effective multidisciplinary collaboration in place. Just like any other organization, this rehab facility was also trying to reduce their hospital-acquired infections. And for their CAUTI, or catheter-associated urinary tract infections, they developed a task force that had physicians, they had infection control practitioners, they had nurses, and their support staff. So those would be the clinical assistants. And what they did was to evaluate the care and the management of their Foley catheters. They looked at their policies, did some changes, and changed some of the policies about peri-care and changing the bags, every day for open systems. And they did a massive education in the organization. And what they ended up doing was significantly reducing the number of infections. Same thing with their pressure ulcers. Again, this is a rehab facility, so they get a lot of spinal cord injury patients and other patients that are very prone to pressure ulcers. So knowing that, they developed a wound care program where the wound care practitioner worked very closely with physicians, with the rehab department, and with family members of patients. And again, look at the dramatic improvement in their outcomes. And then I want to talk briefly about the nurse managers, because many studies do show that someone's primary supervisor, so it's the person that you're directly reporting to, greatly influences your intent to stay in the workplace. So it is important to have leaders that are going to promote trust, someone who's going to promote a safe environment where people can feel like they can openly communicate about concerns, not only about patient care, but also the practice of their colleagues, and also someone who's going to actively promote employee engagement. They need to be visible, they need to be accessible, they need to listen, and they need to be supportive and effective advocates of their staff. And then the last practice standard talks about balanced lifestyle. How many of you flew here to the conference? Majority, right? So I'm sure most of you have learned, have heard the announcement that they make on the plane that, in case there's an emergency and we need emergency oxygen and someone next to you is needing assistance, what do you do first? Put the oxygen on yourself, right? Because you're not going to be of any help to somebody else unless you're okay yourself. So this practice standard pretty much talks about that. If you remember the picture that I showed earlier of the nurse that was so burnt out, how effective do you think she's going to be in providing compassionate care to her patients? And how civil is she going to be when she's interacting with her team? So it's important to have programs in place in the organization that, promotes work-life balance, and things that would reduce burnout. I have to say, when I first joined the American Nurses Credentialing Center, I was thrilled because we had yoga on Wednesday afternoons, we had Zumba on Monday afternoons, we had walking groups during lunch, and they even brought a speaker, to talk to us about the vegan diet, and then a whole bunch of us, did a 21-day kickstart. So just being able to do that with colleagues not only promotes wellness, but, also promotes camaraderie, among your staff. So creating this kind of practice environments really benefits three major groups. We've already talked about the benefits for nurses and the other disciplines, but for the patients, when you have staff that have the ability to problem solve, collaborate, and handle conflict, what you end up with is quality patient care. And also when you have a unit that's working well together, patients can feel that. So, this readily translates to enhanced patient experience and also higher patient satisfaction. And as I mentioned earlier, you do end up with higher safety initiative success rates when, the team feels like, they're involved and they're participating in the decision making. And then for the organization, this could be a huge cost saving, because how much do you think it costs to replace one nurse? A lot. It can cost up to 4 times someone's annual salary to replace one nurse. So just by reducing the turnover and also improving the retention, that could, quickly add up. Also having less safety events, less injuries, that could be, reduced cost again for the organization. And as I opened up my presentation earlier talking about the nursing shortage, when you have this kind of positive practice environments, other people hear about it and they want to work in that same environment. So this becomes, a great competitive edge for organizations. And then lastly, I want to leave you with this message. When you hire talented individuals and they're the right fit for your organizations, and you invest in them, and truly all of this is an investment, you allow them to grow. And over time, what do you get when you spell those red letters backwards? Gift, that's right, because what you're going to end up are gifts. You're going to have staff that are committed, engaged, and aligned with your mission, vision, and your strategic goals, and they're the ones who's going to deliver, the outcomes that you desire. Thank you.
Thank you so much, Christine. How many nurses in the room? Can the nurses raise the hands? Oh, okay. Doctor? Wow. Pharmacist? Wow. Social worker? Okay. What else? And, CEO? Wow. Okay. That's okay. Thank you very much. Any question?
Patients?
Question? Oh, yes, sorry. No. Okay. Oh, one, and then at the end we are going to have more questions. Think what we will do tomorrow using their suggestions.
Thank you. Your slide mentioned retention incentives for the nurse managers, and I wondered what those were.
Retention incentives for nurse managers, yes. That is one of the things that the practice standards looks at. And, we are not prescriptive. We provide kind of like the framework. So when organizations want to use this framework, they come up with different things in their organizations to try to do that. But, one of the things that we're also looking at are making sure that for those who are at the cap of their salary, that they're getting, even some things that are not monetary. So other types of incentives.
Okay. Thank you so much, Christine.